Good afternoon. Thank you for joining me in this presentation to share with you information about the University of Maine System's transition to new health and prescription vendors beginning January 1st of 2026. My name is Amy Parker, and I'm the Chief Human Resources Officer for the University of Maine System. For those who didn't join our last session, I will provide this information and then open up the session to questions that have come in via the Q&A section of the webinar. Please feel free to enter your questions at any time. There is no need to wait. And if you don't hear us respond to your question, please know that we may need to look for further information and we'll get back to you. Please do not disclose any protected health information in the Q&A. I'm going to start today by providing you some background information for context, and then we'll respond to questions at the end. This review process began 10 months ago, and we've spent several months carefully and thoughtfully reviewing our options. Today, I'll share what we learned and the commitment that we're making to support the health and well-being of our employees, our pre-65 or non-Medicare eligible retirees, and your families. In early 2025, we began a months-long request for proposals, or RFP process, with employees representing UMS HR, Finance, Strategic Procurement, and our union partner. Throughout the process, we also engaged with the Employee Health Plan Task Force, a group comprised of employees from across the system and our unions. Additionally, we worked with our partner experts at Maine Healthcare Purchasers Alliance and Willis Towers Watson. This helped inform our decision-making, and I want to be clear that this decision is a management decision, was not made by the unions, although they were informed of our decision-making process. Our desire was an inclusive process grounded in transparency and objectivity. As a reminder, the RFP process is required for public employers because it's a built-in safeguard for how public funds are spent. The rules exist to make sure that our decisions are made in a way that are fair, transparent, and results in the most comprehensive health and prescription coverage for you and your families at the best price. Here you will see an outline of the process that we engaged in. From bid development to scoring, interviews, and final selection, we were focused on one overarching theme. We wanted to find partners who will deliver value, access, and quality outcomes for our members. This mission shaped every decision that this team made. For this process, we were seeking what is called a third-party administrator. A third-party administrator, often called a TPA, is a company that helps self-insured employers like the University of Maine System manage their employee benefit plans by handling the paperwork, the claims processing, and other administrative tasks related to health insurance coverage. The TPA does not insure the employees or pay claims using its own funds. Instead, it uses the University of Maine System funds to pay for employees' approved medical claims. So to be clear, Anthem is not our insurer. UMS is self-insured. This means that UMS takes on the financial risk of providing benefits by paying employee medical and pharmacy claims through this administrator. We then engage in cost sharing for the expenses with our employees through premiums that are deducted from paychecks. This is why managing our health and wellness is critical. We have a responsibility to get you the best care and manage our shared healthcare costs. After a comprehensive evaluation, we selected Anthem Blue Cross and Blue Shield of Maine as our new medical third-party administrator. And here's why. Excuse me. Anthem received the highest evaluation score. They met every mandatory requirement across service, compliance, and benefits administration. Their pricing is competitive, it's reinforced by strong performance guarantees, and results in significant savings in comparison to other plans. They take an innovative approach to individual health using technology and care coordination to improve outcomes, especially in our underserved and rural areas. Anthem offers excellent member support and access for members to real-time claims data via their online portal. This transparency allows you to see exactly what was billed to ensure that you are not being billed for services that you did not receive. Additionally, they will be attending in-person enrollment sessions and are providing printed cards for members. This is in response to feedback that these are features that our employees want. Anthem has committed to support UMS-based nursing scholarships, helping us invest in Maine's healthcare future. UMS is committed to supplying talented healthcare providers to our health systems within the state of Maine to expand access to quality care and addressing the need that exists in our state. A Net Promoter Score, NPS, serves as a key indicator of customer loyalty and the likelihood of recommending services. Anthem's recent Net Promoter Score of 78.3% demonstrates strong advocacy and brand loyalty amongst its members. Net Promoter Scores over 70 are regarded as world-class regardless of the industry. And additionally, their customer service satisfaction score for 2025 is around 89%. This infographic highlights Anthem's impact on access and experience throughout the state. Anthem currently has more than 370,000 members in Maine and has had a presence in the state for 87 years. 507 of their associates supporting our employees are based in Maine, and nearly 20% of those associates are proud graduates of the University of Maine System. Anthem provides us access to the state's largest network, including over 6,500 doctors and 32 hospitals. Approximately 98% of their claims are paid in network, and another aspect that the selection team found reassuring is that Anthem currently partners with the state of Maine to provide insurance to their members. This is an important moment to pause and address the ongoing negotiations between Anthem and Northern Light Health. We understand that this situation has created uncertainty for many. Unfortunately, disputes of this kind are becoming more common as healthcare costs continue to rise nationwide. The rates negotiated between insurers and healthcare systems directly affect what members ultimately pay. It's essential for companies like Anthem to seek fair pricing to help control costs for members. At the same time, Northern Light has to secure adequate funding to sustain its services and maintain a strong presence in the state of Maine. At its core, this dispute reflects the broader challenge of healthcare affordability across the country. The relationship between Anthem and Northern Light is important to both organizations, and we remain confident that an agreement will be reached before any impact to our plans on January 1st of 2026. In the unlikely event that this is not resolved, we are preparing to negotiate with our unions regarding the potential impact of this change and to work with Anthem in the same way. Finally, I received a number of inquiries from those who are receiving care out of state and were concerned about the impact to their network. It's important to note that while Anthem Blue Cross and Blue Shield is based in Maine, they are part of what is known as the Blues network of Blue Cross and Blue Shield, meaning we can access their nationwide network. I'm going to transition to our new pharmacy benefit. Historically, UMS has used an integrated pharmacy benefit, but through this RFP, we wanted to take a fresh look and explore the option of what is known as carving out pharmacy. This slide emphasized Anthem's openness and willingness to partner with us in that direction. They understood our goals, and they showed real flexibility in working across vendors to make it successful. Working to control pharmacy expenses, which are significant, was our primary driver in our decision-making process. I mentioned earlier that transparency from our administrators is important to us. In pharmacy benefit management, data transparency means that the financial and operational aspects of managing prescription benefits is visible and understandable to both employers and our members. Your personal health information remains protected and is not visible to the university in this process. By carving out pharmacy, we separate drug spending from the broader medical plan and negotiate directly with a pharmacy benefit manager. This gives us greater visibility into actual drug costs, rebates, and pricing practices, This reduces the hidden markups that occur when pharmacy costs are bundled into medical claims. Those insights and savings help us better manage expenses, which can translate into lower premiums or slower cost growth for employees and their families. We recognize that prescription costs are among the most significant healthcare expenses that many families face. The pharmacy administrator we selected is Capital RX, which is currently rebranding to Judy Health. Several factors made them stand out. They have a straightforward, flat administrative fee with no hidden markups. There's a projected 15 to 20% savings in the first year for both UMS and our employees and their families. They have a fast, secure, and highly rated claims platform and a 24/7 member support and dedicated account team. They have flexible plan design with full data transparency. Again, your protected health information is not available to the university. And they have a strong commitment to working closely with UMS and Anthem to ensure smooth transition. Most importantly, they offer a comprehensive set of clinical programs that are focused on whole person care, patient safety, and cost management. A key reason that we felt confident moving forward with a carved out pharmacy benefit was the strength of Capital RX's overall offering. Their advanced technology, vast pharmacy network, excellent customer support, and top-rated Net Promoter Score all played a big role. Additionally, their strong privacy protections and industry-recognized data certifications demonstrate their alignment with our goals to protect your data and health privacy. Unlike traditional pharmacy benefit managers that use less transparent pricing models and may steer toward higher margins, Capital RX offers a flat administrative fee. As an example, regardless if the drug cost $50, $500, or $10,000, the administrative fee is $7.25, unlike other integrated solutions where the pharmacy markup is based on a percentage of price. This means no hidden markups and more predictability for our plan. They also benchmark drug pricing using national average drug acquisition costs, which reflects real-world costs and ensures employees and their families get the lowest price prescriptions available. These strategies will help keep us more stable and prices fair for members, their families, and our plan. I want to be very transparent with you when it comes to cost. While our decision was not made solely on cost, if we made no changes for 2026, our costs were estimated to be $101.6 million. By moving to Anthem and CapRx, our costs are estimated to be approximately $95.5 million. While this move to Anthem still represents an increase of 4.5%, the change enables us to slow growth in 2026 by $6.2 million. This is a cost shared by employees and the university system. This decision is part of our responsibility to our students and their families by keeping their tuition costs low and to our employees by responsibly managing healthcare's increasing costs. Also important in our upcoming open enrollment are other health and welfare benefit plans. Our Delta with Delta Dental and our eye care through IMAD programs are not changing in 2026. Fertility benefits will be offered through Anthem. Hearing care will be offered through Anthem in partnership with True Hearing. We will continue to offer health savings accounts for those who select the high deductible health plan, and we will continue to offer flexible spending accounts for health and dependent care expenses. We recognize that these are important benefits for the health of you and your loved ones, and they will continue into 2026. So to recap, we've selected 2 new administrators for January 1st, Anthem for medical and Capital RX for prescription, based on their performance, pricing, and shared commitment to improving member care. We are confident that these partners will support our employees and retirees through this transition and help us achieve long-term sustainability and better health outcomes. We will continue to monitor negotiations with Northern Light Health and Anthem and negotiate with our unions and Anthem to minimize the potential impact to employees who use Northern Light Health. At this time, I'm going to turn the presentation over to Carla Varnum, our Director of Total Compensation, to talk about upcoming open enrollment presentations and additional resources.
Thank you, Amy. Next slide, please. So first of all, let me start by saying open enrollment is the annual opportunity for benefits eligible University of Maine System employees to review, add, change, or waive their benefit plans to make the best choices for themselves and their families. This is the only time of year when changes can be made unless you experience a qualifying life event such as marriage, birth, or a change in employment status. So during the first 2 weeks of open enrollment, which is November 3rd through the 14th, we'll be hosting a series of in-person events across campuses system-wide. We encourage advanced registration to help us plan accordingly, and the registration link is available in the chat for easy access, and it is also on the UMS Healthcare and Prescription Transition Guide, right around the area where the YouTube and this presentation link was provided. And next slide, please. All right. And so additionally, for resources where you can find information, the Health and Benefits Prescription Transition Guide is being updated on a regular basis. As we continue to get questions in, we post those questions to that guide with dates associated with it. So be sure to bookmark that and check back regularly. We are also still engaging with our Anthem and Capital RX partners through this implementation. So any questions that you ask that haven't yet had an answer, we're working through those actively to ensure a smooth implementation effective 1/1/2026. And so please continue to submit your transition-related questions via email to umshr@maine.edu. And if you have benefits-specific questions, continue to feel free to reach out to benefits@maine.edu or give us a call at 973-3373. Thank you, and I think we're opening it up for questions now.
Okay, terrific, Carla and Amy, thank you. So Zach has been answering some questions as they've come in, and I also have some questions for you. And great questions. Some of them are big picture, some of them are a little more tactical or individual. And so we're just going to take these in the order that they come, and just going back to Amy's initial comments at the beginning, that if there are individual personal questions that you have that we won't answer those in this setting, those will be answered privately, and you can also use the contact information that Carla just shared. So the first question is about Anthem and Northern Light, and the question is, if they do not reach a deal, do you have an estimate for how many doctors will be in network for us?
I'm happy to field this question. In that question is very good question, and it's top of mind. So what we did is we had Anthem take a look at their network match that they provided to us based on Cigna's claim data for last year. And originally the network match was around 96%. And with Northern Light potentially coming out of the network, the match is 85%. So we're looking at having an 85% in-network match.
Okay, thank you, Carla. The next question is also related. If they do not settle if they do not come to an agreement, Amy mentioned in her presentation that we'll work with unions on our next steps. And this questioner is curious about, to the extent that we can talk about those steps and what those would be and what would the union's role in that be. Is that something that you can address right at this point?
I can speak to it at a high level. Essentially, it would be similar to when we negotiate a contract. We would engage in what is called impact bargaining. So we would be bargaining over the impact of this change if they do not come to an agreement. So we would be discussing with them how to minimize the impact. And I understand there's a lot of questions about what does that mean? And I don't know until we have proposals in that regard. So we are not being evasive on that question. We just don't know what the options are that might be put on the table.
Perfect. Thank you. This next question, Carla has had before because I had the same question. And this is related to the instructions that were provided in the Google Doc about how do you determine if your doctor is in network or not. And it sounds like this person might have had trouble with that, with the flow and getting that to work. So do you have advice for folks if they are struggling to get access to that information?
Yes, thank you, Kim Marie. And great question, because we do want you to be able to use those resources effectively. So do feel free to reach out to benefits@maine.edu and we'll help connect you with our Anthem representatives. And they'll work to resolve any questions or concerns that you have. I have used it myself personally. And one of the things I can see, because Northern Light Health is top of mind, they have providers kind of color coded. So in pink, if it's a Northern Light Health affiliated provider, it's showing potentially out of network for November 1st starting. But again, we're not going live until January 1st. So plenty of time to have them come to an agreement there. And also for any doctors, providers not affiliated with Northern Light Health, they are in green and anticipated to be a provider for 1/1/2026.
Okay, terrific. This next question I think is related and we may have partially answered, but I think it's worth raising again. It has to do with, again, if the agreement is not reached and what would happen to employees who do depend heavily on Northern Light facilities for essential health care, and maybe just walking through what that might look like for folks.
Absolutely. So that is a great question. And it's something that, we're definitely striving to understand all the impacts and implications and working with Anthem to get us resources to effectively address these questions. We do have out-of-network benefits associated with our plan. So you can still see providers and are familiar with. It just, the amount that the benefit pays differs. So there's higher out-of-pocket costs and may be subject to benefit or balance billing. And understanding that costs are a huge component in making those decisions, we'll work to get you as clear of information as we can on that topic.
Great. Thank you, Carla. This person is anticipating a settlement or an agreement and wondering if that happens, will their doctor who is currently showing out of network then magically appear as in network once assuming the agreement happens? Okay.
Yes.
So their status will return. Excellent, thank you. We have somebody asking, what is the maximum out of pocket per person? Is that something that can be answered globally, or is that an individual question?
It does depend on the medical plan that you have one selected. We have a choice between the copay plan and the high deductible health plan. And so your out of pocket does vary between those two. And we have 4 different versions of our copay plan. So it depends on your union affiliation in that respect. But we are happy to answer those questions. So do feel free to send those type of inquiries to benefits@maine.edu. I'll get you a response.
What about flex spending accounts, Carla? Will those be available?
Yes, and they continue to remain available. Last year for January 1st, 2025, we switched our flexible spending account benefits to WEX, and they continue to be our administrator for 1/1/2026 as well.
Okay, excellent. There are a couple of questions here with some rather specific, I think, questions, and I think as Zach will continue answering them, and also folks should definitely reach out directly to benefits if you don't get your question answered today. Let's see, it looks like this question is specific to the Northern Lights Center at the Orono campus. And the question is there an option to stick with Cigna if the agreement is not reached? I think that their concern has to do with the fact that Northern Light is based here, and I'm assuming from this that maybe that's their primary provider. I'm sort of interpreting a little bit from this question, but I think that the root of the question is there an option to stick with Cigna if they do not come to agreement, I think is the root question here.
And I would say not that I'm aware of at this juncture. We are moving forward with, we have in the past only had one TPA, third-party administrator, for our whole entire system. And that is likely to continue. But again, there's impact bargaining and things that I may not have access to at this point.
Okay. You may have run into this question before, Carla. If folks find that they rely on specialists, and some of them in state, some of them out of state, but they learn that they're out of network now, they'll be out of network if the agreement is not reached. Some of the practitioners that they might be inclined to find have waiting lists that are quite long, sometimes several months long or over a year. So is there advice or a thought for what folks should do if they find themselves in that situation?
Yeah, that's a great question. And I would say that is one that we will be more than happy to help. Primary care is a challenge, and statewide, right? And even more nationwide, holistically speaking. So I understand and appreciate that concern, and we continue to advocate for proactive and innovative solutions to those network access challenges. And we'll work with Anthem and partnerships through maybe some virtual options or considerations on that front. Our unions, whatever we can do to help ensure that our access continues to be strong and we help people get the care that they need.
Great. Thank you. Will existing referrals or treatment plans for specialists or other non-primary care providers be grandfathered under the new plan?
That's a great question. And we have had some questions of this ilk come up in the past. There will be a transition period where we'll coordinate care between one carrier versus another. And then they'll do specific outreach if they need further authorizations under our new carrier team. Does that help?
We'll find out if it doesn't. I'm sure they'll resurface the question. This question is about how reimbursements or upfront costs might work. So according to this questioner, Northern Lights website said that if they're out of network with Anthem, they'll no longer bill Anthem and patients will be responsible for all costs. So the question that's concerning this individual is that would they be responsible for upfront payment and then get reimbursed, or how would that work? Some of the costs, as you know, are quite extensive, and that's a big concern.
Yes. And it definitely depends on the area where you are seeking treatment. Some providers do, even though they're out of network, will work with the insurance carrier. If Northern Light has said that that's not something that they'll entertain, then that is what the process will essentially be out of pocket. In my dealings with Northern Light Health, they do tend to work with you and set up payment plans if you don't have it, and then you can work to seek reimbursement from your insurance company.
Great. Carla, do you know, will there still be incentivized premium rates for completing health coaching appointments?
Great question. So our wellness program is changing, but we are still working with our unions to see what that impact is, and we will communicate as soon as we have that updated information.
Very good, thank you. Okay, lots of concern, as you both know, about this, the uncertainty here. Folks are, and I'm seeing questions from folks who are specifically talking about Orono or North. Their doctors are primarily, if not completely, Northern Light. Let's see. So this question asks, if I find out that Northern Light does not work out a deal with Anthem after I've already opted to stay with UMS's plan during open enrollment, can I change my choice to stay enrolled? And I'm not sure. We might need a little more information there, and because I'm not sure what they mean enrolled in.
Yeah.
So maybe the person who asked that question, it was just about 10 minutes ago, maybe that person can provide a little bit more information. This question wants to know, what does the 85% match mean? Will we receive assistance identifying other providers that are not Northern Light? Some specialties are only offered by Northern Light. So can you talk a little bit more about the 85% match?
Yes, absolutely. And it is all based on historical claim data. So it was data provided in our RFP, de-identified, and we asked that any potential bidder take a look at that data and tell us who at that point in time is in network and out of network. And so using that data, we had our benefits consultant review it, and they determined that if Northern Light Health was to be out of network, that provider match that was originally sent for in the RFP would be 85. So that, and if you need assistance finding a provider, please reach out to us and we'll get support and resources for you to help you navigate that information.
Fabulous, thank you. Zach, if you're listening, there's a question about sharing that Google Doc. So I don't know if that's possible via the Q&A.
Yep, I'll be able to.
Oh, perfect, thank you. Let's see. So somebody, and this might be worth reiterating because somebody said they were late joining and apologize if this was covered. But I think in case others are in the same boat, it might be worth answering. Has UMS signed a binding agreement with Anthem, regardless of what happens with Northern Light?
No, sorry, no. And we are still currently negotiating the contract. And my understanding is that included in all of our contracts, we do have exit provisions to allow for such things. I do want to speak to this a little bit though, because it aligns with the question about whether we can switch. These things are not, they're not quick. They don't happen on a dime. And so I know it's hard to understand why we couldn't just stay the course. And we did explore that option, but we're sort of past the point of being able to do that. And that doesn't mean that should this situation not resolve itself, that we won't reevaluate that, but we were not able to do that for this enrollment period.
Thank you, Amy. I think that's an important point. What about labs and x-rays and things that happen at out-of-patient facilities? I'm guessing that they too, the question is, would they also become an out-of-network situation at that point? If they typically happen at Northern Light, they would be treated as an out-of-network situation. Okay,
Yes,
okay.
except for emergency services, which are covered at in-network rates through hospital systems.
Excellent.
We did also learn that just because a provider is currently affiliated with the Northern Light, that may not be their only affiliation. So don't assume that because they're located at a Northern Light facility, that they don't also have a contract with Anthem, because some providers have multiple contracts. So that's where it would be important to go on and look to see if your provider will be in network.
Very good. Another question related to wellness, and this question is, will there be different premium rates based on whether you participate or not in the in the wellness incentive opportunity?
Do you want me to take this one, Carla?
Sure.
So we are working on this. I'm not able to share more information because we are still in conversation with a few of our units about coming to an agreement about our next steps with the wellness program, but we're hoping that that will be resolved very soon. And I think it will be positive, welcome news for employees.
Very good. Okay. This question is about WEX. And so the question is, apparently this person is curious about whether being considered again as the FSA administrator, or if that is being looked at again. They're talking about their experience with WEX compared to what they had previously. And so the question is that on the table as well at any point?
We do have 3-year contracts with our benefit providers. So yes, last year was our first year. This upcoming will be year 2. If you are having challenges though, I do encourage you to reach out. The Employee Benefits Center has helped several people navigate these if you're having some difficulty. And we'd like to better understand the challenges so that we can work through those and address those in upcoming RFPs and make good decisions for the university going forward.
Excellent. A question here about a specific laboratory and if it's in network. And I guess the answer to that or any in-network question would be to check the website, Carla. This specific question is about Quest. And it's and is that too specific to answer in this?
I'm not aware of Quest being in or out of network off the top of my head, but I'm happy to research that with Anthem directly. Searching Quest in their provider directory might be challenging. So we can help get you answers and support on those specific resources you utilize.
Excellent. A few more questions, and I don't know if these have come in after you answered or talked about the Google Doc or the instructions on how to determine if folks are in network or if practitioners or sites are in network. Can you just once again say that for the group, because that's obviously a big question for many folks.
Sure. So if you follow the instructions on how to find out if my provider is in network through Anthem, and you don't have any challenges going through that process, it'll bring you to their site. And on their site, they do have providers listed in pink currently if they're affiliated with Northern Light Health or soon to be out of network effective November 1st. And then in green, providers are those that are continue to remain in the network more long term. So Anthem has tried to address that on their website, but if you do run into any specific challenges understanding that, do feel free to reach out and we'll work with Anthem to get that corrected or updated.
Excellent. A couple of questions. One is sort of a larger question about the costs. And Amy, I wonder if you might be able to talk broadly about the, and you covered this a bit in your slide in terms of the $6 million, the savings or the decreased increase, that would happen. And I think it's maybe worth at a height, I think it's worth sharing broadly with folks how the decision related to costs happened and why, how our system leadership and how we're all working to balance the costs, because it wasn't a question of staying would have kept things the status quo. I don't know if I'm saying that right, but I mean, with I'm wondering if you can speak again to the question about the overall costs, about is this plan going to save money versus really what our options were around that.
So I want to be careful about how I answer this question because it is not a savings. It is sort of slowing the growth of the expense. So for example, it's roughly 9% increase versus 4.5%, I think were the numbers. So it's not as though it's a cost reduction. It is a strategy to try to sustain the current benefit level that we have. The only other lever to pull in this situation is to reduce benefits, which is not, I don't think we're at that place, and that's not something that was desirable. And I just want to remind everybody that most of this work was done before this situation sort of unfolded and became very public with Northern Light Health and Anthem, which was incredibly unfortunate. So we did not make this decision assuming that Northern Light Health would be out of the network. We made this decision with confidence that they will be in network. And I saw the new CEO of Northern Light Health this week on the news clearly stating that he feels that they will come to an agreement by the end of the year. That is their goal. They are actively working on a daily basis. They are negotiating to resolve their outstanding items. So the fact that Northern Light Health has been public, in addition to Anthem, sort of, boosts my confidence in that. It's kind of a symbiotic relationship. Anthem is, even though we are self-insured, they are one of the largest insurers in the state. And so it would be very challenging for a health system if they did not come to an agreement with the largest insurer. So I see a couple other questions, and Kim is, I think, kindly skirting them. So I'm just gonna address them head on, because I I'm at the point where I could care less for the rest of my life if I hear the number 85, because I want to talk about this 85%. So for those of you that do know me, I think you know that I'm a very honest and transparent person. And there seems to be a belief that somehow we have created this 85% to match the requirement that we had in our RFP, that we have sort of 85% of Maine providers in network. It is a coincidence, I have to be honest with you. And in fact, a number of people have asked, where did you get this data? Well, the data came from actual claims data from Cigna over the past year. So we wanted something recent because if we took old information, those may not be providers that people are using because we're finding providers are moving a lot. So we took that claims data and we asked Anthem to review it and tell us how many or what percentage of those providers would be in network without Northern Lighthouse. And they said approximately 85%, which I understand raises a lot of questions. I absolutely get it. And I understand why people don't believe it, because I've heard, the comments that the University of Maine is the largest campus. How can this be possible? So let me just acknowledge it does not make sense when you first look at it. But we heard your feedback. We took the claims data and we gave it to Maine Healthcare Purchasers Alliance with no expectation of what the outcome was. And we said, can you evaluate this data and give us information about what the match would be? And so they said it's approximately 17% compared to the 15 that Anthem had given us that may be out of network, understanding that we're using last year's claims data. So there's a margin of error there, just given that people may not be receiving the same treatment, they may change providers. So I'm at a loss. I don't know what else to do because we used actual claims data to come to this. I can assure you that I am not hiding anything. It is not our goal to manipulate the data. We have provided it in the way that we can to individuals who have asked for it. We have put some information in the transition guide as more questions came up. So I don't have an answer that explains this. I can just share that it was based on actual data and it has been reviewed by 2 organizations. And I understand why you would question, well, of course Anthem said that. I get that. And that's why we had it independently reviewed. So I think we're going to continue to look at this. I understand there's also a question in here about the bidder in the RFP process. One of our requirements is that they must offer a provider network covering at least 85% of currently utilized providers. We have received a written guarantee from Anthem that that will be met, that they will meet the requirements that were put forth in the RFP. And part of that is because they are actively currently and have been working on expanding their network and developing more contracts throughout the state. So at this point, I can say that we've received a written guarantee. And again, we are confident that they are going to resolve this because we do firmly believe that these 2 organizations need each other to be effective within the state.
Thank you, Amy. Terrific. Had another question about Cutler that I think may be what the other questioner was getting at, which is if they do not settle, if they do not come to an agreement, would Cutler be I scrolled away from the question, but the question is, would the services at Cutler change? Would they, if the idea is that if if they were not considered in network, would we change providers at the Orono campus where Cutler is, which is currently Northern Light?
So my understanding is that that is a separate contract, and I certainly think that that's something we would evaluate if we needed to, because, would that make sense for our community? I don't know.
Thank you. This question is asking if you can speak a little bit more about the grandfathering of existing specialist treatment plans. If specific outreach is required for prior authorizations, could an existing treatment plan see a lapse in coverage while the new authorization is being sought? Good question.
That is a good question. And we're working with our incumbent or Cigna provider to work with Anthem, and so that they can ensure that there is no lapse or gaps between the covered entities. And we are working to ensure as smooth of a transition as possible for people currently engaged in complex care needs. And there will be continuity of care a process that providers will be able to fill out to work with to ensure that the care remains ongoing.
Great. A couple of questions. One specifically about they anticipate perhaps additional paperwork if they have to manage claims differently and for their family, and anticipate that that could take many hours a week. Will the benefits office be able to help folks? And then specifically, the question is, can folks do that on work time? Can they use work hours to take care of some of their health paperwork and so forth? And I don't, is that, maybe that's too, yeah, go ahead, Carla.
I mean, I think that is certainly situationally dependent. And though the UMS Employee Benefits Center is a resource that is available during business hours, so working with your department or supervisor to find the time that you need to take to work through this initiative with the Benefits Center is something that I could envision happening.
Perfect. Perfect. Thank you. Several of these questions, and I'm pausing because several of them I think are situationally, they're individual questions. So
I see a question that I could answer about GLP-1s.
okay. Oh, there it is. Yeah.
Yeah, so there's a question about, Carla, about Anthem and Capital RX will cover GLP-1s for weight loss. And I think this comes back to helping understand the self-insured nature of our plan. So could you respond to that question?
Absolutely. So yes, our plan currently, as a self-insured plan, we do have some latitude in what we can and are unable to cover due to the shared cost of the overall expenses. And our plan has historically and will continue to not cover weight loss related drugs for those purposes. Now, there are other things like diabetes and stuff that GLP-1s are eligible for. And as we work to engage, throughout these processes and in understanding what the needs are of our entire population and how those costs can significantly impact our overall claims experience in the premiums for all employees is something that we take seriously and continue to work through with our employee health plan task force that meets regularly.
This question is talking about specialists in Bangor. There's only a few that are covered. And the question is really about what will the out-of-network costs be? I'm guessing that that would be a question they'd want to ask directly of the benefits center. Okay.
Yeah, I would agree. I do believe we have added that question to the transition guide. Amy, is that accurate? Did we add the out-of-network
I believe
benefits?
so, yes.
Um, so we have a chart that currently shows what our coverage levels are at an in-network rate. And then our intent is to, if it's not there, we will have it posted what our out-of-network benefits. Great question.
I think that the fact that open enrollment is coming right around the corner, starting November 3rd, has some folks concerned because there's still this out there question. Um, and do you have a sense for when we'll know concretely about what to expect? I think that the uncertainty of I think folks appreciate that as we can share information, we are, but that's still there's still it's a lot to not know. And so do you have a sense of when you think we might have an answer?
Yeah, sure. So in working with like the Anthem team, they as Cigna had done, they've provided or will currently working through putting all of our benefits coverage information into plan documents that we can distribute and share during open enrollment. I do not have those yet, but within the time frame of November, we are working towards having those resources so that you can make these very personal and complex decisions with as much information as we can provide.
Fantastic. And Amy, I know you don't want me to say 85, but the question is that number is system-wide, correct? That's based on
It is, yes.
Yeah. Okay.
I should say statewide, not system-wide.
Okay. Yeah. Yep. Okay. Would the university consider an issue regarding out-of-network provider if the agreement is not resolved by January 1st? Would this be considered a qualifying event for special enrollment or plan changes? So if they select something during open enrollment and then wish to change that, would not coming to an agreement, would Anthem and Northern Light not coming to an agreement be considered a reason to be able to go back and make changes?
I think we have to look into that more.
Yeah. Okay.
Agreed.
This is somebody said that they are having a hard time understanding why the University of Maine System would sign a contract that does not provide coverage for the second largest healthcare provider in the state. And so they're asking about the rationale for doing that. And maybe it would be a good time to just give an overview of really at the beginning of your presentation when you talked about all that went into that decision. Do you have an elevator version of that, or should I don't know if they missed the beginning, which is possible. Really the rationale for moving forward. Yeah.
So the decision, well, first of all, you have not signed a contract. So that's one thing. Two, I'm struggling a little bit with the way the question is framed, the questions, and I understand why. So let me first acknowledge that because I hear that people are frustrated. I see a comment that people at the University of Maine don't feel seen, don't feel understood, and don't feel respected. And I understand that because you are in some ways disproportionately impacted by this. The decision to move forward was made based on the fact that in our RFP, we asked or we required an 85% minimum in network, and Anthem has met that. So it is very challenging where that was our requirement to go back and then, make a different decision, knowing that, this was the decision we came to based on a number of factors. Were there things that changed after we did the scoring and all of those things? Yes, and they still met the requirement in the RFP process. And so we find ourselves in a challenging position. And again, do believe that they will come to an agreement. And that was the basis upon which we made our decision.
Great. Thank you, Amy. This is a bit of a revised version of a question that that you just answered, but it's about if after open enrollment, could a person then pull out and maybe go through their spouse's plan, their spouse's employer's plan, if they make engage through the open enrollment process, but then find out that agreement does not happen, could they then switch and move to their spouse's plan? Is that also an individualized question, Carla, or
Yeah, a gain or loss of other coverage is actually a qualifying event. So if you do gain other coverage with your spouse's plan, you can call the benefits center and we'll open the event for you to remove your coverage.
Thank you.
One of the other things, I'm trying to skim through, Kim, to help you.
Yeah.
One of the other things I'm noticing is some sentiments about, you're leaving us behind, or not being considered. I want to reiterate that we are going to impact bargain this with the union. So it is not, I don't think folks should assume that because you go to see Northern Light providers, that you're just going to be cut out and you're not be able to do that. We are going to bargain with the unions, and that is not our intent. There are also some comments about this being a strategy to cost shift this to employees by helping or having people pay out of network. Absolutely not. And I absolutely understand why people are angry and upset and feel this way. But that is not the plan, and that was never our goal. Our goal before any of this happened was to help sustain the current level of our plan design and try to keep it affordable for our employees and their families.
Terrific. Thank you, Amy. This question is about representation on the committee, the initial committee. And specifically, this person wanted to know why USM wasn't represented, but I wonder if just more globally, you can talk about how the committee was selected, the RFP review committee.
Yeah, sure. So generally it's representatives from the most highly impacted groups, I guess. And so we take our employee health plan task force. Is that the committee you're talking about, or are you asking more about the RFP selection?
I thought it was the RFP selection, but it didn't say specifically, so I might have interpreted that wrong.
Yeah. Well, either way, there are avenues. If healthcare is something you're passionate about and you do not feel like you are being heard, you can always share that information with your unions, your HR representatives on your campus, and we will take that feedback and collect that feedback. And if we need to update some of those committees or think more holistically in the future, we can certainly take that under advisement.
This question is about whether they can contact Anthem now to ensure continuity of care. Could they begin that process before January 1st?
Yes, yes. We will have something in our, we are Anthem in our last implementation meeting that we just met with them on Tuesday of this week. They have a form that they can share that we can give to you to give to your provider for that potential transition.
Terrific. Follow-up question on the GLP. Question is about bariatric surgery, if it will be covered, and the follow-up is that, do we know that at this point?
Yeah, I do believe bariatric surgery is currently covered under our health plan, and that aspect should continue.
Thank you. And then this question just came in not too long ago and wanted to know, they said it sounds like we're moving forward with Anthem regardless, and so it might be worth reiterating that that statement a little bit for anybody coming in later. We're just still digesting all of this.
Yeah. So at this point, we don't have an option. We have to move forward because we've begun the implementation, and it is not an option for us to stay with Cigna as our third-party administrator at this point.
Okay. Thank you, Amy. Someone said that it's the question is about unions and involvement at the beginning of this process. I think that their understanding is that unions were not involved at the beginning. Can you speak to that?
Yeah, sure. I'll go ahead and get started, and Amy, you can fill in as we go. Our employee health plan task force is comprised, and we did share the list of who that is, but we do have union representation on that committee. And we did, as part of our monthly meetings, we do talk about any requests for proposal processes we're going through. And we also requested input or invited people to participate in the healthcare RFP as well. So.
Great. Thank you. This person said that they approached the thoughtfulness of the university in making this decision, and that this session has provided greater perspective about the complexity and appreciate the support or the approach that's been taken. And also find some comfort that MEA also uses Anthem, and that also, gives them some comfort that this will be resolved. And so I think that this conversation and other conversations like this are helping to bring folks along in terms of really what to expect and where the decisions have come from and how we're getting there. So this is good. Okay, it looks like prescription prices on the HDHP will be significantly higher than on the HDHP under Cigna. Is there a way to change? Is there a change to the way pharmacy pricing works with the new HDHP?
That's very interesting and individualized. There shouldn't be, there's certainly formulary adjustments that are made Cigna goes through annual formulary adjustments and tweaks as well. So it's not an uncommon thing in the industry. But as far as costs for a current prescription you're paying for, it should not be impacted overly much by this transition unless it's truly not covered by the formulary. So I think if we could take that back and look into more detail with our Capital RX team, we'll have a more thorough, thoughtful response for you through that.
Terrific. Is it true that the cost would have increased if we had stayed with Cigna as well?
Yes, more. It was about double, right, Carla?
Scrolling through, some of these are just supportive of folks processing. This is good.
There is one question that we are still looking into answers to, and I think this is really important for folks, is gender affirming care. So we are getting more specific details from Anthem about that. So for those folks that had questions about gender affirming care, please know that we are looking into that, even though we do not have that answer yet.
Great, thank you. Okay.
Carla, there is a question about what is the name of the Anthem plan when people go on to the Anthem site?
Good question.
Access is like Blue Choice PPO. And
yes.
Is it Blue Choice
it's the
PPO?
Blue Choice PPO plan. Yes.
Pre-approval. So I'm going to read this question, and we may have answered a version of it, but I think we can answer this again if we have. So the Presque Isle area specifically relies on Northern Light. Pines Carry already stated that they cannot absorb the quantity of people who would like to switch from Northern Light. So how would pre-approvals of procedures work for out-of-network providers?
That is a great question. I understood it to be in the pre-approval thing. It does depend on if it falls under the continuity of care provisions or not, which there are specific diagnoses that are covered under that. Pregnancy is one of them, and chronic illness, things like that. If it's a pre-approval for an elective-based surgery, for example, that likely would be charged at or paid at the out-of-network rates, but it would be so it wouldn't necessarily fall under the continuity of care. So it depends on what it is kind of a question.
Awesome. Thank you.
I have another really good question that I'd like to address. So I talked about being self-insured and making decisions about what is covered. So there's a question, if UMS can make decisions on inclusion of treatments like GLP-1s, is there a reason it cannot similarly make the decision to cover benefits for employees with current Northern Light health providers at the in-network rates? Yes. There is a problem with that, though, in that without a contract with them, they can charge whatever they want. And so that becomes very risky because those negotiated rates that the third-party administrator engages in are because they negotiated those rates. And so if you've ever seen on your statements sort of what the cost was and what the negotiated sort of discount is, it can be substantial, and we would not receive that. So that is just something to consider, and we're trying to work through that as we think about how to minimize the impact to employees. You know, what are the things that we could do? But that is one of the challenges with doing that, because it does sound like an easy solution.
Thank you for that background, Amy. Let's see. If we have a question about a specific provider being a network, who can we ask if we cannot figure it out from the Anthem website? And specifically, they noted that it looks like Penobscot Community Health Center is in network and maybe the only in network, but they're wondering if that's misleading. So if it's not clear on their website, or they're not sure if it's clear, if that's the only answer, then who could they turn to?
Yeah, I would say definitely reach out to the Employee Benefits Center. And then once November 3rd arrives, Anthem's phone line will be active for UMS employees, and they can help address some of these first line level of support questions.
Great. A bigger picture question, Amy. Why are, and maybe it's Carla, I don't know, but why are plans different depending on employee classification?
So that has to do with negotiations with the unions. You know, when unions come to the table, or when we come to the table, you know, different groups may have different needs or desires or priorities in negotiating. And so they're maybe willing to make concessions on healthcare in, you know, hopes of gaining something else somewhere else in the contract. And so they are not done in tandem. The negotiations happen separately with each union, and that is the reason for the difference. That's a great question.
Good question. Here's another one. Ready for this? So assuming that we don't want to make any changes to our plan, do we have to do anything during open enrollment, or do we have to actively select something?
That is an excellent question. It is what we call or refer to as a passive enrollment, because our plan structures are staying the same. So therefore, we'll continue to offer your choice between a high deductible and a copay or PPO plan. You do not have to make that election. Your plan will stay the same, and it'll carry forward under our new third-party administrator, Anthem, for 1/1/26. And that said, unless you have a flexible spending account in which you have to re-enroll in every year per IRS regulation.
Okay, perfect. This is another question about negotiation, and the question is, why do we have to negotiate access to health care?
So wages and benefits are a mandatory subject of bargaining.
Great. This question, I want to make sure I may have heard something different. So I'm going to ask this question to see if can you help us understand why we would pay for gender affirming care while electing to not cover weight loss meds that would help in weight loss, thus preventing future higher costs? I may have misunderstood the answer earlier, because I thought that was, maybe it's worth answering the question about weight loss medication again, just to make sure I heard it correctly.
Absolutely. Our plan does not cover GLP-1s for purposes of weight loss due to clinical evidence of the long-term viability in the changes of not making lifestyle changes. So the long-term impacts of the drug and the cost of the drug, you would need to be on it long-term. And at that time, based on the clinical evidence and the fact that we are self-insured, we opted to continue to maintain our not covering weight loss drugs on our health care plan formula.
Thank you. Thank you, Carla. I misheard that earlier, so thank you.
I made a comment earlier. I see there's a sort of a response in response to what I said. And I just want to clarify, because I said the only other lever we could pull would be to change the strength of our benefits. I'm talking about plan design. So what we cover versus what we pay. And those are kind of the two levers that you can pull. So I understand this is not the same level of coverage in your perspective, but as far as like what services are covered, not where they're covered. So I just want to be clear about that.
Thank you.
And I see a question about Anthem sending out booklets about the plan. They are working on establishing our plan documents. We should have summary level booklets available during open enrollment, and the SPDs will be early in the new year as they were when we had Cigna for insurance.
Earlier, there was a question, and I think that it was answered privately, but I'll just ask this question for the group, and it was about insurance cards. Can you speak about whether folks will receive insurance cards, or how will that work?
Oh, yes. So our insurance cards will be co-branded with Anthem and Capital RX, and you'll get the card in the mail. Our open enrollment period ends the 24th of November. So in early December, we'll be sending a file to Anthem, and then from there, they'll generate the cards and mail them to your home address. They should start to arrive by the 15th of December through the end of December, depending on mail times and things of that nature.
This question is about Anthem satisfaction scores, and I think in the presentation we talked about the national statistics of Anthem satisfaction, and this person is wondering if we have scores for Maine in particular, satisfaction scores for Maine in particular.
Not that I'm aware of. I can certainly check with Anthem and get back to you.
Yeah, terrific. Is that something that we could update in the transition guide? Okay, perfect. So for folks who don't know, the transition guide is a place where questions are continuing to be answered and updated as well. And
I did think of something else. So the questions are great because they're sort of prompting additional things. So there is a comment in here about the 85-15%. And I said that lightly just because it's, you know, it's a number out there that when I hear it now, it makes me cringe. But we did discover, and part of this person's comment is it's hard for us to know if a provider is in the Northern Light Health Network and doesn't or does have a contract with Anthem. And I do think that that had an impact on the claims data, because we didn't just look at, okay, you know, is this covered by Northern Light Health? We looked at, will this provider or would this provider have been covered by Anthem? So it is, again, possible that they're in the Northern Light Health Network and they have a separate contract as a provider with Anthem. So that could be part of the reason why you're, you know, perceiving that there are all these providers that are at Northern Light Health. They absolutely are. They may be co-located, but our understanding is that a lot of them are subcontracted. And so they have separate contracts with different insurers and third-party administrators. So that certainly doesn't answer all of it, but I did want to put that out there, that that is part of the challenge that we're seeing. So thank you for making that comment.
I love this this interactivity, because it is giving you it is helping the conversation.
I actually should talk about that, why we didn't do this last week. So, and I did share with the unions, it was not our intent last week not to have an interactive session. It came down to a licensing issue, and we were concerned about the number of attendees on the event, because we do have a limit on our current Zoom license. And so we wanted to make sure that we could communicate with folks, and not have to purchase a new license, which would have been, my understanding is like $25,000. So we resolved that issue this week. So I just want to be clear that this was not an attempt to avoid interacting with people. In fact, we would have preferred it, but we decided to go forward sharing the information because we thought it was important to get it out there. So I'm glad that we were able to take questions in this format today.
Fantastic. Can you speak to what will happen if there is not a specialist outside of Northern Light and the closest provider is about 100 miles away or at a distance? Sounds like another out-of-network question.
Yes.
Carla. Yeah.
And that actually is a great question because we talked about continuity of care and we talked about, our out-of-network benefits that are offered. What we didn't talk about is if you are struggling to find resources in your network adequacy, if they're the only provider within, it's a Maine statute, and I'm blanking on what statute it actually is, but essentially what it means is that if you have to travel a certain distance for primary care, for specialists, for et cetera, they should be subject to a network adequacy review. And what that means is those providers, if they pass that requirements of the law, then they can be covered at in-network rates on the health plan. So great question.
Terrific. Thank you, Carla. Great answer. It looks like we have about 5 more minutes, and I'm looking through to see if we have questions that we've not yet answered, even in the broadest sense. As we're looking for those, maybe this is an opportunity. Amy, did you want to talk about next steps, or Carla? I mean, we've got, obviously with open enrollment coming, we've got the in-campus visits that will be coming up. Do you want to talk about where folks can turn next for answers, and also to continue to be able to ask and get questions answered through the Benefit Center or through the looking at the transition guide? So if you'd be willing to do that.
Absolutely.
Yeah.
So first things first, these questions that we have not yet addressed in here will be, we'll have access to them. We will work on putting those that should be included on the transition guide online for you and getting updated information. Our open enrollment period is from November 3rd through November 24th. In the first 2 weeks of that open enrollment period, we're traveling the state and coming to campuses and doing live sessions. We are asking for advanced registration, and that link to register is in the transition guide. And we're also doing Zoom presentations, but during those meetings, we'll have vendors, Delta Dental, ComPsych, WEX, our new vendors, Capital RX and Anthem, along for the road show, and they'll be available doing presentations, and we'll have side tables for people to ask questions directly of our new vendors and the Employee Benefits Center team personally, and get those things worked through. And the documentation, as I said earlier, benefit summaries should be available during the open enrollment period, and then the phone systems will be live, so you can reach out to Capital RX and Anthem directly for any of those questions, as well as contacting the Benefit Center at benefits@maine.edu or by phone at 207-973-3373, and we'll help work through any questions you have in making those plan selections for the upcoming year.
I do want to add that we have very low registrations for our on-campus open enrollment sessions. And in order for us to continue doing those, we would need to see that people are interested in attending them. So if that's something that you want to do, please register, come and meet with our vendor partners and get to know, Carla and get, personal answers to your questions in person. So we'll hope that we will see you when our team goes out to campuses. I think we're all set. So we're going to wrap it up for today. This will be posted. We'll continue to answer your questions, and I want to appreciate the folks who've tuned in. Thank you very much for your time this afternoon. And again, we continue to welcome your questions and comments. Thank you and have a great day.
Thank you.